For more, let's cross to correspondent Bastien Renouille, who joins us from Nairobi. Bastien, this meeting between the Congolese president and the head of the UN's health organization, the WHO, was scheduled for earlier in the week. It's finally happening.
Yes, and among other things, the WHO is calling on the reopening of the borders between the neighboring countries, Rwanda, Uganda, and the DRC, because at the moment it's very difficult to bring humanitarian equipment, humanitarian like doctors, etc., into the DRC. So that's one of the reasons. And also, closing the borders is not the best idea, they say, because in this part of Africa, borders are very porous, and it's very easy to cross between the DRC and Uganda, between the DRC and Rwanda. And the equipment to make sure that people are not infected with Ebola is at the border point. If these people cross in the forest, it's impossible to make sure that they're not going to spread a disease somewhere else, as it was the case in Uganda earlier. There's been a few cases in Uganda because people crossed the border from the DRC. So that's why the United Nations and the European Union have started an air bridge between Kenya and the DRC at the moment to bring more doctors, to bring more supplies to help DRC, because this outbreak is in the Ituri region, which is very far from Kinshasa, the capital. So it's easier to bring equipment from neighboring countries. And since it's not possible because the borders are closed, from Kenya, which is not that far.
Yeah, let's listen to the head of the WHO, Tedros, speaking upon his arrival in Kinshasa.
Travel ban, not only WHO, but the consensus in health, public health experts, that travel ban doesn't help. This is based on research done on many occasions. So there are ways to manage borders and to manage cases without having strong travel, restricted travel ban, and we don't encourage that as WHO.
Now, Bastien, you mentioned those neighboring countries. We see, for instance, in Uganda, the number of confirmed cases has increased from 7 to 9. How do you convince the leaders of those countries, again, to keep those borders open so you can screen people as they go through?
Well, that's very difficult. That's one of the main issues because, politically speaking, it's easier for the leaders of these countries to just close the borders and tell other people that, look, you're safe. It's not possible for Congolese to come to your country and nothing can happen anymore. But that's not true. So what needs to be done is first to bring humanitarian assistance, to train the doctors, to make hospitals ready, to have screening facilities, to make sure that every case is recorded, because that's how you fight Ebola. Fighting Ebola is very difficult. It sometimes takes weeks to heal a patient, and there is no specific treatment for this specific Ebola outbreak. There is no vaccine at the moment. So that's the first thing. You have to develop the medical sector, and then you need to convince people to get treated. And that's one of the main issues, because sometimes people are afraid. They see that those who go to hospitals sometimes never come back. And what happens in these hospitals is hidden, because it's very dangerous to get inside these hospitals. So the population doesn't really know what's happening in there, and so they're afraid. So that's why governments, NGOs must mobilize locals to help them. They need to talk to the community, to convince them to collaborate, to go to hospitals when needed, to avoid touching people who are infected, to avoid touching dead bodies, which is sometimes a tradition in this region. So that's a very huge work. It sometimes takes months to be implemented, but that's the only solution to end this outbreak.
Bastien Renouille reporting live there from Nairobi. Many thanks for that update.